Hey, good morning. I'm Vic Senese. Be sure to like and subscribe. Today's important bladder cancer update focuses on a question many patients with intermediate risk non-muscle invasive bladder cancer, or NMIBC, have asked. After years of normal cystoscopies, do I really need to continue having them forever? New research published in European Urology Oncology suggests that carefully selected patients with intermediate risk NMIBC, it may be reasonable to reduce or even stop surveillance cystoscopy after 60 months or 5 years, if they remain cancer-free. This does not mean bladder cancer surveillance is no longer important. It means researchers are exploring more personalized approach based on patients' long-term risk. So let's take a closer look at what the study found and what it could mean for patients. Non-muscle invasive bladder cancer is one of the most common forms of bladder cancer. In non-muscle invasive bladder cancer, it's found in the inner lining of the bladder and not invaded into the muscle. Treatment usually begins with a procedure called a TURBT, or transurethral resection of a bladder tumor, where visible tumors are completely removed. After treatment, patients undergo regular surveillance cystoscopy. It's coming into the office for a peek. A cystoscopy allows a urologist to look directly inside the bladder using a small camera. The reason this follow-up is necessary is because bladder cancer is one of the highest recurrence rates of any cancer. However, recurrence risk is not the same for every patient. Patients with intermediate risk NMIBC have a higher chance of recurrence compared to low-risk patients, but generally have a lower chance of progression to aggressive disease. The challenge for physicians is to find the right balance. Detect recurrence early while avoiding unnecessary procedures, anxiety, discomfort, and healthcare costs when the risk becomes very low. Researchers performed a pooled analysis combining patient data from 4 multi-center randomized controlled trials in the United Kingdom. The analysis included 578 patients with intermediate risk NMIBC. The studies included HIVEC-2, FAUNA, BOXIT, and Caliber. The research patient age was approximately 69 years, and nearly 3/4 of the participants were male. All patients had complete tumor removal through TURBT or bladder biopsy procedures. After treatment, surveillance cystoscopy was performed at regular intervals, usually 3 months, 6 months, 9 months, 12 months, 18 months, 24 months, 36 months. Researchers then evaluated recurrence and progression over 5 years. The overall recurrence-free rate was 56% at 36 months and 54% at 60 months. Importantly, researchers found no significant increase in recurrence risk between 3 and 5 years. One of the most interesting findings was how recurrence risk changed over time. The risk of bladder cancer recurrence was highest early after treatment. At 3 months, recurrent risk was approximately 90%, but the risk steadily declined. By 36 months, the recurrent risk dropped to about 17%, and by 60 months, the risk for another recurrence was less than 5%. Researchers also found that higher grade disease or stage progression occurred in fewer than 5% of patients. Cancer-specific mortality was approximately 1%. The study identified several factors associated with higher recurrence risk: previous recurrence history, multiple tumors, known as multifocal disease, and, of course, higher grade tumors. The authors concluded that after 5 years without recurrence, reducing or stopping routine surveillance cystoscopy may be a reasonable consideration for some intermediate risk NMIBC patients. So what does this mean for you or loved one that has intermediate risk bladder cancer? First, do not stop your cystoscopy appointments on your own. Every patient is different. Your urologist will consider your tumor history, number of tumors, tumor grade, prior recurrences, overall health, and personal preferences. The future of bladder cancer is moving towards personalized surveillance, monitoring patients based on their actual risk rather than using a one-size-fits-all approach. And for some patients who have remained cancer-free for 5 years, fewer cystoscopies may provide reassurance while reducing unnecessary procedures. As always, decisions about bladder cancer and follow-up should be made together with your healthcare team. Hey, that's today's update from UroNurse News. If you found this information helpful, why not subscribe, like, all that good stuff. And join us next week for more information on UroNurse news. Now, this Saturday on UroNurse, it's a condition many patients experience but few feel talking about: genital psoriasis. A common yet frequently underdiagnosed condition, genital psoriasis can impact far more than the skin. It can affect physical comfort, emotional health, intimacy, relationships, and overall quality of life. Because symptoms occur in a sensitive area, many patients suffer in silence, unsure who to ask, embarrassed to bring it up, or worried they won't be understood. Hey, this one's good for 0.75 contact hours, so tune in and check it out on Saturday at UroNurse.com.
The experts' opinions in this communication are personal and not representative of any organization. They are for informational purposes only, not official guidance. Viewers are advised to use their judgment, seek additional advice, and take responsibility for any actions based on these opinions.